hear that Newfoundland spends the most per capita on healthcare. You're talking about more doctors, more healthcare professionals. What's your opinion on that? Do you think we need to spend more, or is it a better use of what we're spending?
I think you have to take one thing into consideration. You know, Newfoundland is a huge island. It's geographically very isolated, and so if you're looking to get one of Jody's patients in to get, say, an MRI, that patient has to travel. There's a cost associated with that. If they're on social assistance, that's the trip is paid for. So there's a whole lot of reasons why our costs are higher, and I don't think that's necessarily a bad thing that they are higher in those type of circumstances. If you had our population, and the whole population of Newfoundland is about the size of Winnipeg. If we were Winnipeg, our costs would be significantly lower, but we aren't, and we have to keep that in mind.
We hear a lot about the fact that younger physicians are not coming into the system yet. I've heard personally from young doctors who have graduated and want to come and practice here, but have not been able to. Can you shed any light on that for me, how on one hand we need these physicians, but on the other hand, some of them are not getting their foot in the door and they want to practice here as family physicians?
Or simply not competitive with even Atlantic Canadian provinces, let alone other provinces within Canada.
But even for ones who would come here under the current circumstances and the current, for the current salary? Any of those stories?
Well, salaried physicians would mostly be in very rural communities, because most physicians in urban centres would be fee-for-service, as Dr. Callahan talked about, where you pay all your own secretarial expenses and all your office expenses. I can't think at the present time of an area that wouldn't accept a family doctor. I haven't heard that, I'll be honest with you. And I teach residents in my practice, so I see at least 5 or 6 family practice residents per year, and I work in emergency and see them. So that's not something I've heard, and whether there's a specific circumstance, hard to say. Certainly in specialty areas, sometimes that may be the case.
One of my colleagues said something about being, reactive as opposed to being proactive, and I have heard of cases where within family physicians and specialists where there has been an expression of interest to work in a certain place, and that position might be filled in that community at present. So I mean, there are, I guess, restrictions within positions and whatnot to some of that. I mean, I think in an ideal world, from our perspective, you need 3, there's an interest of 4 who's a new grad. Let's take that person, because in some near future, in all likelihood, someone else is going to retire or move on or whatnot. But I do believe there is some confines in the system like that.
Some of you have traveled from across the province today to tell the public how you see the system from your perspective. Do you think this system of having these news conferences and informing the public is in any way having an effect on how the public views the predicament of doctors, either in a positive or a negative way?
I would certainly hope so. I mean, I think, when we've got a patient sitting in front of us, they're there concerned and worried about their own medical care. They're not really thinking about the big picture, and it only affects them, as you heard Jody say, when that test they are waiting. And as you heard Wendy say, they're talking about the nervousness and the anxiety about the wait. So I think that for us to give the public information about this is what it's like for us, and this is how we worry for you all the time, is an important message.
Any indicators that it's working, this strategy of informing the public from various perspective of various specialties?
I'm thinking that the best person to answer that might be Lynn Berger, who would be monitoring it, but I would hope so. Certainly I know I was on the YouTube video and there are hits there, so people are looking. Yeah.
I've had patients say to me in the office that they've heard and have listened to YouTube to hear some of the specialists who have already been on, and that they're very surprised because they didn't realize that that was actually what was happening. So I think it is being effective, and hopefully over the next number of weeks will be more effective as more people realize that these interviews are available.
And we don't, on a one-on-one basis, we don't kind of share with patients that we're worried about you, we have anxiety about this, I didn't sleep last night and thinking about this. But I mean, these are some of the realities. I mean, I would never have thought a decade ago that, I could have sleeplessness about, worries about the system and worries about my patients. And, I sort of thought I was naive to all those pressures, that was for somebody else. But, we do worry about our patients. And, people are good people. We know our patients worry about us. I sometimes at 1 o'clock hear people say to me, "You didn't get a lunch break today, did you?" And sometimes patients say, "Would you like me to run and get you a coffee or a sandwich?" And they are our neighbors and our friends. And, obviously you go into this profession because you're concerned about patients. And I think leveling with people and telling them that it's difficult for us, not that we still want them to come and tell us their troubles, but, we are concerned about them. We want to be a part of the solution in fixing some of this.
What's it like for, somebody who's obviously trained to cure people, to have to take what you do every day and have to take it to this level that you're sitting in front of a camera and a bunch of reporters and having to, in a very political way, try to put your point across? What's that like for you?
Well, it's quite difficult for me. I'm not a person who would say something is difficult. You're trained to, type A personality, suck it up, do good at this, do this. I'm going to have a successful career and have children and be involved in the community, and I can handle all of this. Right? I can handle all of this. This is not a problem. That's your culture. So it is a little bit difficult to say that it's difficult.
Dr. Graham, I think you mentioned you were on plan to stay in Port Basques for a couple of years or something like that. Why have you stayed, and what do you see as your future?
I see my future there. I've been very clear that I would not stay if our number of doctors were to drop below a certain number, but provided working conditions are manageable. I stayed because the practice is great and rich and diverse, and I think it's a great place to raise children, and I like my life and my work there, and I just wish it was more manageable in terms of working conditions. So I do plan to stay there, but I guess in terms of that life-work balance, if the conditions were to deteriorate, then I would pick my life over my work, and I would unfortunately have to move on. But I have no intentions of moving away from Port Basques or Newfoundland.
Dr. Woolfrey, you're out in Botwood. What's your thoughts on that?
Well, I stay because of the relationships that I've formed with people over time, with colleagues in nursing and other support staff, with the community itself, and having 2 young girls that have been born and raised in Botwood. It's become our home. It's where we are comfortable being.